In the previous session, we have completed the specific features of hyaline, elastic and white fiber cartilage. In this session, I will be discussing on clinical anatomy of cartilage. Osteoarthritis is the gradual loss or changed physical properties of hyaline cartilage in joints. The overuse of a joint leads to wear and eventual degeneration of the cartilage and cover the bones where they meet in the joints. Joints that are weight bearing, such as knee joint and hip joint, and heavily used joints like wrist and fingers are most prone to cartilage degeneration. The loss of protective cartilage causes the joint inflammation as two bones start to rub directly against each other. The picture shows the normal cartilage in the knee joint, and this other picture you can observe the worn out cartilage. The fragments released from the wear and tear get sandwiched between the two bones during movements and increase the damage, causing pain and inflammation. The intact normal articular cartilage is as seen in the side view of the knee joint. Worn out articular cartilage as seen from side view, which causes the joint inflammation as two bones start rubbing directly against each other. You can see the worn out cartilage in this picture, the second picture, okay, only the bone is present which is rubbing against the other bone, okay. So this is the worn out cartilage seen as in the side view. The two pictures shows the worn out cartilage which is surrounding the articular surfaces of the bone. After any disease or injury, regeneration of cartilage is very minimal. Why? Because of the avascularity. What happens to the defects? The defects are filled by the fibrous tissue. Okay, so because it is avascular, there is no regeneration, or it is very slow, very slow in healing. Even if it heals, it is replaced by the fibrous tissue and not by the cartilage. How do you stop cartilage degeneration? Exercise regularly every day so that the joints are in mobility. It will fight stiffness and helps protect the cartilage from more wear and tear. If it is told exercise regularly, it doesn't mean you have to overuse the joint, okay, and always be doing the exercise, okay. Restrict the time to 1 hour or half an hour every day, okay, to exercise. According to Dr. Bush Joseph, orthopedician in Rush Medical College, the more joints move, the more the cartilage gets nourished by the joint fluid. So, how is degenerative cartilage treated? It can be treated through physiotherapy or possibly surgery. Surgical techniques may be encouraging the growth of new cartilage by drilling small holes in the nearby bone or replacing the damaged cartilage by two methods. One is with healthy cartilage taken from another part of the joint, or the second method is by artificial body part called prosthesis made of metal or soft material. Coming to the difference between the calcification and ossification. Calcification is the hardening of tissue by the deposition of calcium carbonate or some other insoluble calcium compounds. It is of two types, normal and pathological. In normal, the process occurs in the formation of bone. In pathological conditions, calcium is deposited abnormally in soft tissues. This causes soft tissue to become hard. Calcification of soft tissue such as arteries, cartilage, heart valves can take place due to vitamin K2 deficiency or poor calcium absorption. Poor calcium absorption is mainly due to vitamin D deficiency. Ossification or osteogenesis is the formation of bones from osteoblast cells. Ossification takes place approximately 6 weeks after fertilization in an embryo. It is mainly classified into two types: intramembranous ossification and endochondral ossification. Intramembranous ossification is formation of bone by mesenchymal cells converting directly into bone cells. Endochondral ossification is mesenchymal cells converting to cartilage model, and the cartilage model is then replaced by bone. In fetal life, greater part of skeleton is cartilage. Cartilage model of long bones gradually is replaced by the bone. Coming to the tumors, different types of tumors. Benign tumors are more common in cartilage. They are non-cancerous tumors and are called chondromas. They are found mostly in the small bones of the hand and feet, humerus, femur, and ribs. These tumors rarely produce symptoms but can cause the affected bone to easily fracture. Chondrosarcoma is a rare type of malignant tumor or cancer that usually begins in the bones but sometimes occur in the soft tissue near the bones. Chondrosarcoma is most often seen in pelvis, hip and shoulder, and more rarely in the bones of the spine. Osteochondroma, also called as osteocartilaginous exostosis, is commonest of benign cartilage forming lesions. Osteochondroma is an overgrowth of cartilage and bone that happens at the end of the bone near the growth plate or epiphyseal cartilage. It mainly occurs at lower end of femur, upper end of tibia and humerus and scapula. It most often occurs between ages 10 and 30. Enchondroma is the term used for the benign cartilage forming tumor that develops centrally within the interior of the affected bone, while chondroma, as discussed before, refers to the peripheral development of lesion. Chondroblastoma is relatively rare, benign, non-cancerous tumor arising from the epiphysis of long bones adjacent to the epiphyseal cartilage plate, mainly upper end of tibia and humerus and lower end of femur. Chondroblastoma mostly seen in children and young adults and is curable with surgery to remove the tumor. In old age, the hyaline cartilage will be calcified. Usually, large laryngeal cartilages are affected. Collagen fibers in the hyaline cartilage become prominent with age and may become fibrous cartilage. Articular cartilage, which is hyaline, then elastic and fibrous cartilage do not undergo calcification. With this, we have completed histology of cartilage. To recap, we discussed the introduction, composition, general arrangement of cartilage, specific features of hyaline, elastic and white fibrocartilage, and the clinical anatomy. In the next session, I will be discussing the summary of cartilage.